Several patients are experiencing weight loss after enrolling in the medical weight loss program at Doctor's Hospital. Patients are first assessed by Dr. Jan Martin.
A medical weight loss program invites persons who are overweight or obese to come in and get assessments to determine their level of obesity. Here at Doctor's Hospital, our program begins the moment you walk in through the doors. You sit with me and I perform an assessment. I get a dietary history from you, how you presently eat, what a meal looks like for you in a week, breakfast, lunch, and dinner. I do your height and your weight, and I determine your body mass index. Determining your body mass index tells me whether you're overweight or obese. Based on that, I stand you up and I measure your waist and your hips, and I determine your waist to hip ratio. Now, the waist to hip ratio is important because visceral fat or abdominal fat places a person at a higher risk of developing cardiac illness or increased hypertension, elevated cholesterol, specifically triglycerides, and type 2 diabetes. And so your waist should be smaller than your hips. But we assess the medical risks associated with obesity with your body mass index, but not everybody who has a high body mass index fit into the obese category, because your body mass index can be elevated due to increased muscle, because muscle is heavier than fat. And so that's why we look at your waist to hip ratio as well. The waist to hip ratio, the larger your stomach, the more at risk you are for developing type 2 diabetes or high blood pressure or cardiac illness.
Dr. Ranga explains the intragastric balloon procedure.
So the balloon, as you can see, the size after it's inflated in the stomach, it's about the size of a grapefruit. Yeah, that's the size, just to demonstrate the size. So once inside the stomach, it occupies about 2/3 of the stomach. Half to 2/3 of the stomach is occupied by the balloon. So it just sits there for the 6 to 8 months, 6 months. And because of that, the brain is tricked into thinking the stomach is full all the time. Yeah, that's one way it works. And another way, it also delays gastric emptying, which means whatever food that we eat or liquids that we drink tends to sit in the stomach for longer than normal because of the balloon. And it takes more time to pass further. So there's a feeling of fullness in the stomach. So thereby, the patient starts to eat less because he or she feels full all the time. And because they eat less, they lose weight. So that's how it works.
Patients explained why they joined the program.
Well, I decided to join the program after the pandemic came, and I heard the risk of being obese with COVID, and chances are higher to get COVID. So I said, let me see what I can do for myself to avoid getting COVID. So the first thing I did was, let me see if I can lose some weight.
Well, I decided to join the program because I saw Desiree Major. She was losing this weight. And it was like so amazing. And I was like, how are you losing all this weight so fast? And she was like, she turned me on to Chan. She said, man, go to Chan, and and then so that's how I get turned on to this.
Lifestyle changes and a great support system was necessary for success.
Well, the lifestyle changes. I have to be mindful of my choices of food selection. My lifestyle, I am a social butterfly. So I hop from restaurants to bar and I drink. So I had to pull back on alcohol intake in order to be successful with this weight loss.
My lifestyle change has been great. I lost a lot of weight, and I'm eating healthy now, and I'm sleeping better. I used to snore. I don't snore like that no more, So, and I mean, it's important for my sex life is even better. So, all of this, I'm enjoying.
The support system is excellent. I get support from Jan, my coach, my husband, my daughter, also my colleagues at work and my friends. They are always there to support. So it's excellent.
Well, my support system, I had Jan behind me. I had Desiree behind me. You know, sometimes Jan called me. She calls me, hey, you missed your session. Sometimes I stalk her because, you know when you cheat, you'd be ashamed to come. And I can't tell her, oh, I just been drinking, when I just lost all that weight, But she calls me up and then I have my best friend Terrace behind me, and then I have my two support system right there.
Raymond and Desiree are happy with their progress.
I am very happy with the program. Yeah, and I also, reason being I'm so happy, I found that I was diabetic too, and I would have never found it out if I didn't come to Jan, so all that, she encouraged me to change my lifestyle, it's scary, being diabetic, so I didn't want to really take those insulins, so how that is, right?
Actually, I achieved, because I did goals in intervals based on time frame, and I achieved my goals quicker than what I expected it to be, and it was not as hard as I expected it, because as I said, it's not a diet. So I was not restricted to not eat this, not eat that. I still eat whatever I want to eat. I just know the amount, the portion size, what I'm going to eat, and how I'm going to balance my meal. So it's great.
Desiree highly recommends the program.
I recommend it to persons daily, because when people see me now, they'll be like, what did you do? And I tell them, it's a lifestyle change. Watch what you eat, do fitness, and you will see the results, People tend not to believe it. I recommend them to Jan. I heard a few persons who came to Jan, and they are successful also, and they are also recommending.
Contact Doctors Hospital for more information. Free assessments are being offered in July.
Anyone who feels that they are overweight or obese should seek us out. They can call us at 302-3256 and make an appointment, or they can go online to Doctors Hospital website and make an appointment to come in and see me and have an assessment done, and then we move from there. For the month of July, to market Doctors Hospital Medical and Surgical Weight Loss Solutions program, we have assessments, free assessments every Friday at Centreville Medical Centre between the hours of 8 and 12 p.m. 8 a.m. and 12 p.m. every Friday at Centreville Medical Centre. We will be performing free assessments to the general public. Once we've done the assessments, we determine whether you're eligible to enter the program based on your body mass index. And if you would like to enter the program, then we take it. We give you all the details of the program.
For Bahamas at Sunrise, this is Kyrie Albury.